Welcome back to Friday Facts. I'm Dr. Alice Barsoumian, an infectious diseases physician here at BAMC.
Hi, I'm Dr. Elizabeth Markelz. I'm also an infectious disease physician here at Brooke Army Medical Center.
It's been a while since that we've had this Friday Facts format, and I'm really glad to see you guys back again and spend more time with you talking about ID.
Yes, I love coming back here with Dr. Barsoumian and talking about an infectious disease topic. So what are we talking about today?
Well, in the news, you may have noticed that there is an outbreak going on. So a couple things up front. This is the season where we see a lot of infections. We call this flu season, but in my house, I like to remind everybody it's really cold and flu season, where you get a lot of respiratory viruses this time of year. Every virus kind of has its own seasonality. But along with those friends are the friends Norovirus. Have you been following any of the outbreaks for Norovirus?
Yes, I have, and mostly like on different chats that I've been a part of and some physician mommy groups where people are talking about Norovirus and all of the GI problems that they're seeing in themselves and in their children. So Norovirus, you may have heard about people having increased diarrhea, vomiting, and it's just happening a lot lately. And you may have seen it on the news, or you just may have seen it, unfortunately, among your friends and families over the holidays.
Yeah, so norovirus is that contagious virus we frequently associate with cruise ships, but it actually happens all year with an increased seasonality this time of year, November to April. This year is one of the worst years, and there's been a lot of discrete outbreaks. So in the news, we've also seen a link to oysters from the Pacific Northwest area, British Columbia, Washington State. But remember that this is a contagious virus that can be transmitted person to person, but also persists on surfaces and is quite catchy.
Yeah, it is. So if you look at the infections that cause diarrhea and associated with food, norovirus is the lead cause of that. And it is because it is very hardy. It persists. It's hard to kill. Even sometimes if you're trying to kill it with temperature, so cooking your food, you have to get it to high temperatures for a persistent period of time. So as Dr. Barsoumian mentioned, definitely you've seen it in the oysters. A lot of people consume oysters raw, so that's definitely high risk. But there also have been outbreaks with fresh fruits and vegetables as well, since those typically don't get cooked.
With the surfaces too, we don't get to always know where we pick something up. We have noticed that because of cohorting of people, increased numbers of cases will be in daycares, schools, nursing homes, military barracks if they get in there, things of that nature. So during this season, it is important for hand hygiene and to try and do the things that we do anyway. So washing our hands before we eat. So if you've touched something, then washing your hands before you consume a meal, it prevents it from getting into you. Hand sanitizer, I think, is a great option for most diseases and disease states, including diarrheal diseases. It doesn't work so great on norovirus. We like to think of trying to get the virus off of our hands, and so that's where the washing can come in, and drying with a paper towel as well, just to make sure all those contagious particles are off of your hands.
Yes, so great hand hygiene, do that 20-second of hand washing, and really be pretty deliberate and trying to clean your hands. And if you are unfortunate enough to get sick and have a diarrheal illness and you're suspecting that you have norovirus, it's important that you typically try to stay home, especially if you work with children in daycare. If you work in cooking, food handling, you really should stay home for at least 2 days until all your symptoms have resolved. And again, it's because this virus is just so easily to transmit, and that's usually how we get it. So yeah, there are discrete outbreaks, but most cases you get not knowing because people may still be shedding the virus, and you're getting it from those individuals either directly or from the surfaces that have been contaminated. So again, if you work in the healthcare field, you take care of others, work in daycare, work in food preparation, please stay home for at least 2 days until after symptoms resolve.
Now, to try and figure out when you should come and seek medical care, I do want to let you know that there's no medical treatment antiviral for this virus, and there's no vaccine for your family members if you've recently gotten infected. The reasons to seek medical care would be if you can't manage your symptoms at home. So if my patients are vomiting too much where they can't stay hydrated, or pooping so much that they just can't replace the fluids, too weak to get out of bed, things like that, I think that those patients are the ones I recommend to come into the emergency room or an urgent care center so they can get evaluated. And certainly as we age, or if we have other underlying medical conditions, we might just have higher scrutiny to see when that time is right. So it's the dehydration and the electrolyte imbalances that can get you with this, in addition to just feeling terrible.
Yeah, absolutely. So stay hydrated. And definitely when we're thinking about hydration, you want to avoid high sugar drinks for hydration. That is not a good way to hydrate, and actually can exacerbate a lot of these symptoms when you're having diarrhea. So I think it's important, hydrate with appropriate electrolytes, avoid high sugar. And another thing to avoid as well when you're having the acute diarrhea, or when you're recovering, is dairy as well.
Yeah. So those are the basic tips that we have for you for norovirus. I know we've dumped a lot of information out there, but there are a lot of resources that you could get more info if you wanted to see it. The CDC website has been updated with the particular items that are under scrutiny, as well as different things you can do, and the recommended cooking temperatures for shellfish, as well as additional food hygiene measures.
Oh yes, and some other things that you may not think about is how you store some of your food in the refrigerator. Certainly if you have raw shellfish, really trying to keep that food separate from other consumables that you're not going to cook, such as your fresh fruits and vegetables that you may consume raw. So again, just kind of trying to think about that cross-contamination. But those resources on the CDC are great. Perhaps we're able to share those with you as well. So let's try our best to stay free of any diarrheal diseases this winter.
That is my hope year-round, to be honest. I have many children and many patients, and so that's not always possible. But 2025 is looking bright, and I know we can take care of each other.
Yeah. Well, Happy New Year, everyone.
Happy New Year.